Okay, so I just got off work and I really wanted to talk about what it's like being recorded by family members, um, working in a facility as a CNA. And, at first I was like, okay, accepting of it. At first I was like, I understand because the reasons why family members would like to record their loved ones in a facility because they could be living in a different state, country, etc., just far away, the distance. They want to make sure that their loved ones are being taken care of properly. They want to be there for their loved ones. They want to have conversations. They want to be able to support them in any way possible, whether their loved one is feeling lonely or maybe has dementia, Parkinson's, etc. Whatever the case may be, they want to be there to support their family, right? So I completely, and for safety reasons as well, you know, I completely understand the severity of why family members would like to have cameras and in the facility in their loved ones' rooms, right? But recently I started thinking, or I started to become uncomfortable with a camera in the room while I am giving care. And the reason being is because we're just supposed to be trusting. And it's another thing if it was by the facility. Yeah, I'm not a huge fan of facilities with the whole camera thing, but I understand it. Um, but it's another thing if it's the facility, right? But when it's a family member, you know, putting a camera inside of a room and I'm performing care. So now your loved one is being exposed on camera. Like, what kind of mess is that? You know what I mean? It's very weird. Um it's To me, I view it as inappropriate, but I guess you could argue, there could be an argument that a family member has concerns about the care that their mom or dad is receiving, right? And so they would want to look at how we give care. Well, I don't know. I understand that concern, but I also feel like it's weird exposing your family member to care. And I've recently started feeling weird about being on camera while I'm giving care, because not just that reason, because I just started to think how inappropriate that feels to have just your loved ones' privates on camera. But also, I'm on camera and I'm just supposed to be trusting that what you do with this footage, it's only for your mom or your dad or your brother or your sister. Like, it's only just to check in on them because you miss them a lot. It's only right. But the same, I feel like you don't trust me. So why should I just be trusting to you? You know what I mean? Um, it just, it's an unfair fight. Um, the reason why I'm talking so slow is because I'm trying to edit my words, if you can't tell. So that way, one, I'm trying to be the most professional when having this conversation. I don't want to, I am talking about I guess anytime you do talk about your job online, you risk the chance of being fired. But two, with that being said, I'm trying my best to really just have a honest conversation and to really talk about my honest feelings about this. But how do I not know that you're like, you could be zooming in on like a boob or something and then posting that on TikTok? Or how do I not know that you were just, to your standards, the family member standards, you were unhappy with care and then decided to do a whole think piece on TikTok? You know what I mean? It just, I don't like being on camera by family members because I don't know what you're doing with my footage. Regardless of what you say, I don't know what you're doing with my footage. Um, and so for the first time last night, I said, you know what? I feel uncomfortable. And I kept seeing the camera move. And I was like, you know what? I'm performing care. So I like walked up to the camera and I was like, I'm performing care right now, so I'm covering this. I covered the camera. And then a light went off, so I attended to that patient before I began care on the patient that has the camera. I came back and the camera and like I guess the camera was moved so much that the cloth came off of it. I just put like a pillowcase cover over it. So I covered it back up again and I performed care. And I don't know, it's a Saturday morning as I'm talking about this, so it could be very well Monday. You know, Monday morning they could possibly complain or something, I don't know. But I just thought and obviously like I'm talking to the camera, so it's not about me being on camera because well, it is about me being on camera, but it's not about technology in general. It's about like I have control over this video. I have control over everything that I post online. But when I'm performing care on someone else, I don't have control over someone utilizing that footage to zoom in on me, to talk about me, to post me online in my work care settings. Because I truly don't be talking about work. I know, like, I mean, I do like a day in my life as a CNA, things like that, but I really don't, I don't know, I really try to keep it, I'd rather talk about pop culture, I'd rather talk about, I don't know, anything else really, just because it's really hard to really talk about everything I'd like to talk about when there's HIPAA laws, and I don't not want to, you know, participate in any HIPAA violations and all that. So, but yeah, it was just something that I did for the first time today. I was like, look at me all bold, you know? But yeah, I decided today I'm not okay with it. And I guess what I'm saying is, you know, if my job said that, oh, you have to do this or whatever, then I'd probably bounce. Because I realized today I'm really truly not okay with it. I'm not okay. It's another thing if it was the facility putting in the camera, that's different. But just a family member who most likely, in my opinion, they could have had like a younger person put this in. You know what I mean? Like a younger family member possibly. Just, and honestly, it's just from thinking about past experiences working as a private aide, working in home care before and all that stuff. It's usually the families, when you think about it, the families usually get someone who is younger to set this up, give them their password. So who's to say, like, you know, maybe it isn't I don't know, the 60-year-old daughter or son, or maybe it's the 15, 16-year-old child that set up the camera, and then they're entering in the passwords and looking in and may possibly be using the footage in a horrible way. And mind you, I'm not saying that's the case in the situation, but I'm saying, like, I don't know, and that's why I don't want to be recorded. So yeah, I don't know. I just wanted to know your feelings about it, because my feelings are, I guess I just said my feelings about it, and it was enough for me to, after I was, you know, done parking, to make a video before I got out of the car, because I'm like, I was really thinking about it, and I'm like, I really don't like it. And I was thinking about, am I gonna get in trouble on Monday? Because I straight up, every single time I went into the room to perform care, no, I put a pillowcase cover on it. So I'm like, are they gonna complain? I don't know, but yeah, it's something that I'm not going to agree with. That's my boundary. I'm not going to be recorded in a work care setting by people who I don't know, and that footage could be online. You know what I mean? Like, so even a CNA, like, I had to have a license. I had to have some type of schooling, even if it's like the minimal, like the smallest amount of schooling. I had to do something to illustrate to my state and other states that I can perform care. And I'm just supposed to trust this family, like it just, anyways, what are your thoughts? I'm just, it's a hard no now for me. Moving forward, when I'm performing care, it's a hard no.